Hello guys, welcome to my channel. If you're seeing my face for the first time, my name is Nancy Ozo. I am a registered nurse. This channel is all about health education. In my previous video, we talked about HIV and AIDS. We explained what it is all about. We made mention of the mode of transmission, its signs and symptoms, the preventive measures to take in order not to be infected. In today's video, we'll be talking about one of the preventive measures of HIV and AIDS. We'll be talking about a medicine, a drug used to prevent HIV, known as PrEP. But before we get started, please subscribe, hit the subscription button, turn on the notification bell so that you'll be the first to see my video anytime I upload. So, without wasting much of your time, let's get straight into the business. What is PrEP? PrEP simply means pre-exposure prophylaxis. Pre means before. Exposure means being vulnerable or exposed. Prophylaxis means prevention. So this PrEP is a medicine that helps prevent one from being infected from HIV. It is a medicine that helps reduce the risk of getting HIV from a HIV positive person. Who can take PrEP? PrEP is taken by a HIV negative person. Before you take PrEP, you have to go for HIV test to ascertain your status. PrEP helps reduce the risk of getting HIV through sex by 99%. And it also helps reducing the risk of getting HIV through injectable drugs by 74%. Also note that PrEP does not prevent one from other sexually transmitted infections. So therefore, it is advisable to use condom when having sexual intercourse. For oral PrEP to work, it has to be taken as prescribed consistently every day. PrEP is a daily drug. It is not a drug that one will start. Though you can stop PrEP, but it's not like a drug that you will take as at when needed. It is advised that serodiscordant couples should be on PrEP. What do I mean? For partners that one is HIV negative and one is HIV positive, it is advisable that the HIV negative person is placed on PrEP. It is advisable to be on PrEP as long as you are exposed to HIV. What are the drugs for PrEP? The US Food and Drug Administration recommends 3 drugs for PrEP: 2 oral, 1 injectable. Truvada and Discovery are the oral drugs recommended for PrEP, while Apretud is the recommended injectable drug for PrEP. And this injection is being given once in 2 months. But for the oral PrEP, it is taken daily for as long as one is being exposed to HIV. One cannot just wake up and start taking PrEP. Before you start PrEP, you have to visit your healthcare provider. He or she will have to educate you on the importance of PrEP, give you more counseling, and also perform HIV testing in order to ascertain your HIV status. If it turns out positive, you cannot take PrEP, rather you take antiretroviral therapy. But if negative, you start PrEP. PrEP can be discontinued if there is no risk of exposure. But if there is a risk for exposure, it is advisable that you continue taking PrEP. What are the side effects of PrEP? In some people, PrEP can cause insomnia, dizziness, nausea, diarrhea, headache, and so on and so forth. But that doesn't mean you should stop PrEP. The side effect does not last that long. With time, the side effects will stop. In summary, PrEP is a drug taken by a HIV negative person in order to prevent him or her from getting the HIV virus. You can only take PrEP if you are at risk of exposure. If you are at risk of exposure, that is when you can take PrEP. You can only take PrEP if you are HIV negative. Remember I said PrEP reduces the risk of getting HIV through sex by 99% and through injectable drugs by 74%. I also mentioned that PrEP does not prevent one from getting other STDs. That is, you ought to use condom during sexual intercourse. STDs means sexually transmitted disease. PrEP does not prevent one from getting sexually transmitted diseases or infections, which is why condom is also required. Once you are on PrEP and there is enough PrEP in your bloodstream, even if there is condom tear, you won't be infected. What I'm trying to say is that PrEP only protects against HIV, not other STDs. So we have come to the end of today's education. Please subscribe, like, comment, turn on the notification bell. You will be getting my videos more often. I hope this video impacts knowledge on everyone that is watching it. Thank you. Bye.